Hello students, today we are back with the last section of the chapter going on in class 12, that is the reproductive health in unit 1. Unit 1 deals with reproduction, and in that we have read the first 3 chapters and the 4th chapter is going on reproductive health, and today is the concluding part of the reproductive health. In the last section of our class, the previous video, we have seen about the population explosion and the various birth control methods, isn't it? Now, in this concluding part of the chapter reproductive health, we are going to read about 3 most important things of this chapter from which questions comes, that is about your medical termination of pregnancy, and which is called as your MTP, and this is related to somewhat of that of your amniocentesis. If you remember, in my first video I said about amniocentesis, which is generally done to know the disorders, genetic disorders in the developing embryo, but sometimes this practice of amniocentesis is done to know the sex of the unborn child, and once it comes to know, means people come to know clearly that the child which is going to take birth is a female child, then they abort it, and that abortion is called female foeticide, which is very common practice, which was a common practice and which still is a common practice in many parts of our country illegally. And medical termination of pregnancy means the abortion of the pregnancy due to some reason. Now these reasons can be many. The reasons is if the pregnancy which the female is bearing with, if that is having some kind of genetic disorder which could be fatal for the child after the birth, or which could be fatal for the mother if she gives birth to such kind of a child. So in that case the doctor suggests MTP, that is medical termination of pregnancy. But to abort a child just on the basis of its sex, that is because the child, unborn child, is a female child and the couple don't want that female child to take birth, if that is practiced or if that is done, then that is a severe crime. So MTP earlier was not legalized, but it was in 1971 when Indian government legalized the MTP with some strict obligations, with some strict rules, that it can be done only under the serious instructions of the medical practitioner, that it is severe for the life of the mother as well as it can be fatal for the life of the infant. So as a result, MTP in those cases is legalized, or it can be done. But for just killing the female child on the basis of amniocentesis and knowing the sex, that type of MTP is not legalized at all. Okay, so this is to get rid of some unwanted pregnancies. You will be amazed to know, rather surprised or grieved to know that annually in the world 45 million to 50 million MTPs are done. So that is almost 1/5 of the total population which is added every year in the population of the world. So such is the seriousness of this MTP, which should be strictly banned, or which should be only done in case it is totally urgent to be done. Next is sexually transmitted disease in this chapter, which is also known as your STDs. Now the sexually transmitted diseases, why does it happen is of course because if someone is having that is the sexual intercourse with multiple partners, or if someone is not using the kind of precautions, that is a birth control measures, especially the barrier methods are very effective in controlling the STDs. So if they are not maintaining hygiene, if they are practicing this sexual practice with more than one partner, then that can be a serious issue. This may lead to sexually transmitted disease. If one of the partner is suffering from the sexually transmitted disease, it can be easily transmitted to the other partner. So this is actually what is this STD is about. Now this Sexually transmitted diseases can be categorized into many, although in the NCERT the various diseases have not been mentioned except few. Like the sexually transmitted disease, in your book what is being mentioned is that other than the 3 sexually transmitted disease which just now I'm going to tell you, the other sexually transmitted disease, if it is detected earlier, in the early stage if it is detected, then they are curable. Now which are these 3 dreadful diseases, the sexually transmitted diseases which cannot be cured? One is of course the AIDS, okay. One is the AIDS, which is caused by HIV virus, that is human immunodeficiency virus, and the second one is that of your Hepatitis B, which is again a viral disease which is caused by Hepatitis B virus. This is also because of sexual that is your practice with the person who is infected with Hepatitis B virus, and this is also not curable. Okay, so this is also not curable. And another one is genital herpes. Now genital herpes is also caused by a virus. The name of the virus is herpes simplex virus. So other than these 3 diseases, which are all the 3 are the viral diseases, the rest are the sexually transmitted disease, whether it is bacterial disease, whether it is a protozoal disease, whether it is a fungal disease, they are curable if they are detected earlier, and this may not have a long lasting effect on the patient also. But the problem is that by the time a person knows clearly that he or she is suffering from sexually transmitted disease, it's too late. So it is better that if some kind of abnormality appears, any kind of pus formation takes place in the genital areas, or any kind of inflammation, any kind of that is your discharges, blood and all those mucus and all those things are discharged from the genital areas of any person. So it's better that one should immediately consult a medical practitioner and do the tests. Now there are various tests available. Immunological tests are there to detect. ELISA is one technique. Then DNA hybridization, Western blotting technique is there to indicate about your AIDS and Hepatitis B. Besides, PCR is there, that is polymerase chain reaction. So all these techniques are actually used to detect the sexually transmitted diseases, and once it is known, then accordingly the precautions or the preventions can be done. Like if it is a bacterial disease, antibiotics are available. If it is a fungal disease, antibiotics are available. Sulfa drugs are available. So this way a person can get rid of this problem very easily. And as far as this AIDS, Hepatitis B and genital herpes is concerned, well, if a person suffers from AIDS, the incubation period of the HIV virus ranges from 6 months to that of sometimes 6 years or 7 years. So one may not even know that the person is HIV positive, and he or she may infect her, if she is a lady, she can infect her unborn child. A person unknowingly can infect his wife, or a wife can infect unknowingly to her husband. So this other way, besides the sexual practice by means of blood transfusion or infected needle, also this sexually transmitted diseases can be transmitted from the infected person to that of the healthy person. Now sexually transmitted diseases can be avoided if during the coitus a person uses that of your the barrier methods like the condoms and the diaphragms and all those things, because by taking the pills, that is contraceptive pills, will not be helping to get rid of the sexually transmitted diseases, but those barriers are really very fruitful in prevention of the sexually transmitted diseases. And it has been noticed that the sexually transmitted disease is very common in case of the age group of the people who are young. So because they young people think very little before doing anything. I'm not underestimating the young people, but yes, means they are very emotional, they are very energetic, and they always do what they think is correct to them without taking any kind of advice. They don't want to take any kind of advice. Especially this happens from the adolescent period. You also are in adolescent period, so you are well acquainted with it. Sometimes what you think is correct, even if your parents or teachers or your elders are guiding you not to do something, it can be anything, but you want to try that. So while trying that, if this kind of things are being tried by the youngsters, then this may lead to a kind of trap. and that trap is the STDs, that is a sexually transmitted disease. So it's better not to fall into this kind of trap, and if at all somebody is suffering from any kind of this kind of either bacterial, fungal or protozoal or viral STDs, they must immediately consult the medical practitioner to avoid how much is possible for them and to lead a normal life. The next thing which has been discussed in this reproductive health, the last part, that is infertility. Now we have been talking about so much about the population explosion, the government's the health facility programs, how to control the population, but yet we are just discussing this topic, infertility. Why are we doing so? The reason is because you see, married couple after a certain age of their married life, they all want to become parents. So when they want to become parents, if either of the partners are unable to produce normal gametes and the fertilization is not taking place, that results into this phenomena which is called infertility. So it is the incapability of either of the partners not to become parents, means they are not able to become parents by the normal reproductive procedure, that is your sexual intercourse and all. So there are various techniques for that. We call them as well as your assisted reproductive technology. Okay, so assisted reproductive technology is the method by which the infertility can be overcome. So what are these things? For this we have to learn two things. First, one is in vitro fertilization and another one is in vivo fertilization. Now see, in biology always remember one thing, in vitro means something which is done in artificial condition or in laboratory condition, okay, not inside the body of an organism. Then we call this technique to be in vitro fertilization. Best example is test tube baby. This is why I told you the best example, because test tube baby is a common thing nowadays and everybody knows what is a test tube baby. Earlier people had an idea that test tube baby means the entire baby is born in the test tube. It's not like that. Actually the process of fertilization is done in petri dish or in a test tube with some nutrient media where the sperm and the ovum is allowed to fuse, and when they fuse, they fertilize, they form the zygote. Now you know that zygote is unicellular, isn't it? Now when the zygote will further multiply, they will form a mass of cell. Remember we said morula, blastula, so many stages after the stages of fertilization before implantation. So when the zygote divides into blastomeres, okay, and it comes to a stage of 8-celled condition. Now this 8-celled condition is then by means of laparoscopy, by means of needle, by means of injection, is injected into the fallopian tube of the female, okay, and this technique is known as your ZIFT, Z-I-F-T, zygote intrafallopian transfer. So this is a zygote, 8-cell zygote, which is implanted into the fallopian tube of the female. Okay, and after that the further development, that is the zygote moving further, doing the cleavage inside the body of the female, coming to the uterus, implanting into the endometrium wall, and it is covered by that of the endometrium tissues, then formation of placenta, umbilical cord, further development, gestation, parturition, everything is normal. But since the fertilization took place in the test tube or in the petri dish, so that kind of baby is called as your test tube baby. So the world's first test tube baby, it was in the year 1978 and it was in England, and the name was probably Louis Brown. She was a girl and Louis Brown was her name, and she was born as a first world's test tube baby in 1978. In India, the practice was done lately. It was in 1986 in Mumbai. Somewhat Kumari Harsha, yes, Kumari Harsha was her name, and she was the first Indian test tube baby. So this is the history about the test tube baby, and now it has become a common thing for those people, those couples who do not have the normal way of giving birth to the child. So ZIFT comes under in vitro fertilization, and that will result into, of course, a normal baby after the everything is normal, because it is implanted into the fallopian tube and then the procedure is normal. IUT, intrauterine transfer. Now what is this intrauterine transfer? Is that I said 8-cell condition in case of ZIFT. Sometimes if the 8-cell condition proceeds further, 16-cell or more than 16-cell, then that embryo, when it is implanted directly into the uterus, U stands for uterine, that means uterus, it is transferred there, then the further development is done there normally, then that type of technology is known as your IUT, intrauterine transfer, and these two will come under in vitro fertilization, okay, coming under ART, that is assisted reproductive technology. The second case is in vivo fertilization. This word vivo, vitro I said in the laboratory condition, vivo means in the body of the organism. Okay, so when the fertilization program is done in the body of the organism, so definitely the fertilization takes place in the female body. So what has to be done is in the female body. Sometimes some females are not ovulating properly. Even if the ovulation is taking place, the ovum is not able to reach to the ampulla isthmus junction. Before that only it is destroyed, or it is immature. It is not able to withstand the condition in the fallopian tube. So what happens is that sometimes some donors are there. Some donors are there which will be donating the ova. So they will be collecting the ova. Then the ova can be put into the fallopian tube of the female, and then when the normal that is copulation takes place, the sperms if reaches there, and then the fertilization takes place, that may result into formation of a zygote, and then the further development is normal. Okay, so in that case we call that type of technique in which the gamete is transferred. Here either it can be ova or it can be sperm also. I did not say about sperm, but sperm also are responsible for fertilization. So some male parent, they have insufficient sperms. Even if the sperms are sufficient, the shape of the sperms are not good, the maturation of the sperm is poor, sperm count is poor. So all these things lead to infertility in case of the couple. So sperms also can be transferred to the fallopian tube where the mature ova is there. So in this case the female is normal, she is normally ovulating, but the male is not capable of fertilizing. So in that case the semen can be collected from any donor, or even from the husband also artificially it can be collected, and it can be injected into the ova of the female's fallopian tract, and as a result the fertilization can take place normally. So since here the gamete are getting transferred, so we call it as gamete intrafallopian transfer. Gamete is getting transferred where? In the fallopian tube. Okay, so gamete intrafallopian transfer is a case of in vivo fertilization. Now it is the next thing, which is intracytoplasmic sperm injection. Intracytoplasmic sperm injection means here the sperms are collected from the donor or from the husband, and it is directly injected into the ova. It is not injected into the fallopian tube, it is rather directly injected into the ova. So when such thing is done, we call this technology or this technique, in vivo fertilization technique, to be ICSI. Okay, intracytoplasmic sperm injection. The last one is your AI, that is artificial insemination. When artificially insemination is done, that means the semen is collected from a donor or from the husband, and it is pushed into the vagina or into that is your uterine cavity by means of laparoscopy, so that now the sperms will be moving ahead into the fallopian tract, and where they will get the mature ova or the ovum, the fertilization will take place. So these are all coming under your ART by means of in vitro fertilization and in vivo fertilization. Those couple who are not able to normally become parents, they can become parents. But the problem with this kind of technology is that it is quite costly. Okay, the instruments are very costly. Always the programs are not success. That means always when this kind of things are done in artificial condition, or even under the guidance of some expert medical practitioner, it is always not successful. So failures are more compared to that of the percentage of getting the success of being parents. So people get disappointed, and there are various ethical issues. People don't want to go for it, they want to normally try. So all these things or all these reasons are there, because of which this art is not so much in practice for the common man. But yes, people who have money, who have faith, and who have patients, they can go for this art technology, and they can get fruitful results, of course. But India being such a highly populated country, and in India, you know, while giving birth, there are many cases, many instances where the mother dies soon after the infant is born. So such children are kept in orphanages. So there are hundreds and lakhs of such children in our country, and there are various organizations, various NGOs who are looking after these children in the hope that some parents, these children someday will get. So if we want to, you know, enjoy the feelings of parenthood, of course we can try for adoption process also. If we can adopt a child who is homeless, or who is not having any parents, or whose parents have abandoned that child soon after the birth, so that will be noble thing to be done for the society. And also the child will get a home, will get some parents, will get proper food, nutrition, shelter, education, everything. So a feeling of happiness, satisfaction and contentment can come to the child's life also, and to the parents' life also, if they want to enjoy the feelings of parenthood. So this way, if we can go ahead with this kind of thinking, although people do not think in that way much, they want their own child. So for this reason, this adoption procedure is not so much in practice in India. But yes, people are getting educated, they are getting more, concerned about a healthy society, society in which they can, help the people who are in need, who are abandoned. So feelings are changing, emotions are changing gradually, and it will be changing also in future. And with the hope of that, we end this chapter of reproductive health. I hope you have understood the basic concepts of reproductive health. Now what you're going to do about this chapter is that you're going to make points of this entire chapter, because this is a short chapter. So you're going to put more emphasis on the points, like I have made this medical termination of pregnancy. Under this you have to make, when was it legalized in India, why is it done, why under which circumstances it can be done. Then sexually transmitted diseases, which are the diseases which if it happens it cannot be cured, which are the other diseases. Now other diseases like gonorrhea and syphilis, which I have mentioned here, that gonorrhea is caused by Neisseria gonorrhoeae and syphilis is caused by Treponema pallidum. So these two are the bacterial diseases. So you should know some names of bacterial disease also, which is sexually transmitted, then your viral disease also, which is sexually transmitted, then your some protozoal disease also, and some fungal disease also. Just for your knowledge, one example at least from each category of bacteria, fungus and your protozoa, you must note down in your copy. And these three are very, very important. So these three, all the three you should know with the causal organism. Next, infertility, you should know about the full forms in this particular topic. What is ZIFT, what is GIFT, what is ART, what is IUT, what is ICSI, what is AI, and all these things, and that's it. So if you will be practicing this chapter in this form, any type of questions comes, you will be able to answer them, isn't it? So with this hope, we will now take upon the next unit, unit 2, okay, and unit 1 is completed.